So let's begin. Feel free to just express yourself. How has COVID-19 affected you, your family, and or your community?
The family.
Well, I think it changed everybody's life in one way or another. Those of us who are older went through the Second World War, we went through a lot more. So we were kind of prepared, I think. And I mean, I was in high school and I remember the things that we had to do. So you fell in and you did what had to be done. There were problems, yes. But for myself, I think it was fairly easy.
Anybody else care to share? Yes.
Yeah, for me, the COVID pandemic seemed to be an exercise in extreme self-discipline between the masks and not being able to go here and not being able to go there. It was, I know, like, I had more anxiety over all the rules than I did over the disease. You know, I mean, yeah, I was hearing and watching the news, and yeah, they're showing all these zillions of people dying, but when you looked at the number of cases against the number of people dying, I looked at it like if 2% of the people are dying, that means 98% of the people were going to get better.
I'm not laughing at you.
You know.
James and I, we just had a joke to have.
So
continue.
yeah, so it
And
was
that's
like,
when he's looking at me.
yeah, like, you know, I mean, I actually benefited from the COVID pandemic because I was able to collect unemployment as a freelance. I'm a freelance DJ, so I'm a gig worker. So I only work when somebody hires me.
Yeah.
And when get-togethers and parties basically became illegal in the state of New Jersey, that basically qualified me to be able to collect unemployment for a year and a half.
Okay.
So it kind of was a financial turnaround. You know, in spite of, again, being an exercise in extreme self-discipline, which I'm not the most disciplined guy around, so it was kind of hard.
That was hard.
The disease, I mean, I caught later on and wasn't that big a deal, but all the rule changes and the, like, basically militarization of basically everybody just kind of like wore on me. Like, I wished I was in Sweden.
Mm-hmm. Oh, that's an interesting perspective. James, you started to talk about family for you. It was impact your family. Do you want to say a little more about that?
Oh, because you couldn't see, because because you couldn't see him at all, you know, like my nephew, the baby, I couldn't see him because, and then when I got the, and then he gets kind of, how you put like he misses me, like it's kind of sad, you know, because I haven't seen him for a while. You know, so I think it affected him more, you know what I mean? Because I couldn't see him.
Mm-hmm.
You know, then I couldn't see my nieces, so I kind of made it like uptight, you know what I mean?
I'm not going to look over there.
You know, so that was kind of hard, you know.
It was really the first time any of us experienced anything like that.
Mm-hmm.
Like, it was so unknown.
But you know, like I said, repeating myself, the Second World War, we had to do that. We had to do those things.
That's right.
And
See, I wasn't there then.
I wasn't
either. I wasn't born
And,
yet. Second.
we just did it, and you never
Yeah.
questioned it.
Yeah, my dad went through the Depression and all that, and I heard all the stories
You don't
about the Great
question it.
Depression, and you know
You
that
just
was
do it. It was a
that,
different
and the
generation.
war. I mean, you know, my dad was in the service in World War II and stuff. So, like, yeah, I heard a lot of those stories.
That's what I say. For myself, it was kind of easy. I just fell in.
Very interesting. Sheila, thank you for joining us.
Thank
Glad
you
could
for
work with us.
tolerating me
Oh,
being late.
please.
I
It's
couldn't
all
help it.
about flexibility, right?
Okay, good.
So Mary Jean started with the first question, and maybe she wants to repeat it for you.
So Sheila, how has COVID-19 affected you or your family or your community?
Complexly, it's very complex. I think everybody has their own approach. Then you have your approach. Then you have to allow for other people and what they are doing, you know. And if you think there's something better they can do, you have to let them know that. You know, or try it, or suggest it, or something like
I'm not laughing at anybody here. So.
One really nice thing is that my daughter Elissa, and this was so fortunate, my daughter Elissa flew in from California the day that they decided to shut Shalom House down to outside people.
Oh my God.
So I said, look, my daughter's here from California. I don't want her in California. It's horrible there. I want her here, and she's going to be helping me. So that's how we did it, that she was my helper.
Oh.
Which was good, because I ended up having my right knee replaced.
Oh, God.
It was good timing, you
Yeah,
know,
there you
as
go.
far as that goes. So, but one of the unfortunate things is that I was going to the University of Pennsylvania for my teeth. And I had gotten one implant, and they had this whole program and everything, and I had been going for like 3 years at that point. And they put in like temporary fillings after root canals. They never went back and put permanent fillings, and the teeth just disintegrated
Oh.
with the temporary.
Oh, so that's how
So
COVID
I
affected
have
you.
No teeth. That I never got. Well, actually, the doctor thinks I had COVID before anybody was talking about COVID.
He
Because in
did.
January, I got very sick.
He did.
Chest congestion,
Didn't
you
know what it was.
headaches, horrible. And he thought it was COVID.
Right.
After like a year and a half
Sure.
of seeing people with COVID, I
And
guess.
they have no tests then.
Right.
Yeah, they didn't have any tests back.
Right, and Frank, you experience, or feel like you've experienced COVID prior?
Basically, when I got it last May, it was the same symptoms as I had in March of 2020, which was just before all the lockdowns and all that. Because I used to go to the casinos, to the concerts every week. I was in crowds of thousands of people, didn't bat an eyelash about anything, even though I was hearing all this stuff on the news. I'm like, yeah, okay, whatever. It sounds
Me
like
too.
sounds like the flu. You know, I've had the flu a million times, so I didn't think much of it. And just basically, I mean, it just basically took, you know, a few Advils and a bottle of cough medicine taken over about 4 or 5 days to get
Yeah,
rid of.
to feel
It was,
better.
more-
It is my phone.
you know, but I mean, a lot of people did get it bad. I mean, even in our building, we had an outbreak in January of like 2021 or something, and we lost about a half a dozen people.
Where do you
Really?
live?
Margate Terrace across
Oh,
the
you live
street.
across
Every
the
time I
street.
Really?
I start to go. So.
Well, I think that it's been positive and negative. I think people have become more withdrawn from, you know, reaching out or doing other things. I myself, but one of the things that happened is that it ruined my teeth. I was going,
That's
they
terrible.
kicked me
That's
out
messed up.
because
That's
I had
terrible.
some medical issues. They wouldn't.
But yeah, they wouldn't let you, they
The
won't
guy
do this and do
that
that. I
saw
remember
me
that.
had never seen me before.
Well, after
So-
this session, we can talk with you about trying to help you get those teeth fixed.
Yeah.
But we gotta talk about the vaccines
Well, that's what
now.
I think, is that, you know, that was a side effect of not having any care.
Right, and that's how it affected you, right?
Yeah.
So-
And wearing for 2 years.
And wearing a mask can't be good for the teeth.
Although it hides that section there so nobody knows that you don't have any teeth, right?
I figure I'm lucky, they're still wearing masks, I can get away
Right,
with wearing
right.
masks.
All right, everyone.
I don't believe in the vaccine.
You don't believe it?
I don't.
Okay, so
well,
we're gonna
here's
have
your
that question.
opportunity.
Okay, now just raise your hand, and how many of you received the COVID-19 vaccine? Okay,
That's why I
good,
don't
that's,
believe in it.
But there's
Okay,
a lot of
that's
shots, though.
seven-
How many, who got how many shots?
right,
Four.
right, okay.
There's 4
There
shots.
was 5.
And how about the booster, everybody? How about the booster?
I got the third booster.
You got the third booster?
I got
Wait a
the
minute.
booster, but I didn't get the last one.
So
I
we
got
got
the
Wait a second, there was the first shot,
Right.
Then there was the second
dose.
shot.
And then the
And then
booster.
3 boosters.
And then the
And then
booster,
three
correct.
Oh, I only had 2 boosters.
Yeah, that's what I
That's it.
had.
So
That's it.
let's,
You got two?
let's
A
just,
couple months ago.
they'll be interested in this. So how many people have had, raise your hand, 4 shots, whether you call them boosters or whatever? Okay, so that's 1, 2, 3 people. And then how many have had 2?
I have the first one and the second one.
Okay, that's 1, 2.
Two, okay, not the booster.
I had two.
I had 3.
You had 3 shots.
I had 3 shots.
Okay.
You didn't get the new one.
I had 3 shots.
Okay,
Two
and one
regular and
person
one
is
booster. I got
2.
two.
Okay. Okay.
I got the new booster and didn't get the booster last year, and got the first booster. I skipped it.
Okay, so what were your reasons for getting the shots?
I
What were
thought-
your reasons?
I thought that I wouldn't get sick because they kept saying if you get the 2 shots and the booster, you won't get sick. And I got sick. And my friend went along with me, and he got that too, and he died.
After getting the shots?
He died from COVID. Did he die from COVID or from something
From
else?
COVID.
Yeah. That was a scary thing.
Yeah, because
Seeing the numbers.
if he wouldn't have died from the COVID, he wouldn't have died because he did have medical issues.
Yeah.
He was diabetic and he
Yeah.
had more issues, lung disease and
You
everything.
can't get immune, you can't build an immune system to handle COVID when you're dealing with all those other
Right,
things.
so he got the COVID from me. I went to this hairdresser, the one I went to today, and she says, everybody take your masks off. So stupid me took my mask off, the next day I had COVID. So anyway, what happened, I took my mask off, and next day I was started to cough. And then I said, I'm going to urgent care. I went over to urgent care, and I said, I have a cough. I said, but I don't think it's COVID. I said, yesterday you got my hair done, and I said, today I'm coughing. So he says, I'll give you something, but I want to check you for COVID anyway, he said. So he checked me, and he says, you have COVID. So I told him what happened. I went to the hairdresser, and she said, everybody take your masks off. I said I was very foolish to do that. I said I should have walked out the door not to listen to her, you know.
But it's supposed to take like 3 or 4 or 7
Yeah, it
days to
takes a
get
while.
infected.
Yeah,
Like
but
you got it
you don't get
before.
infected
I had-
immediately.
She got it before.
No, I had
she
it
was
the
sick.
next day. I wasn't coughing before that. And the next day,
It's hard
somebody
to
in
know.
there.
Sometimes
It's
the
hard to
symptoms
tell,
come
and
out.
That's what part of the
Somebody in
problem
there
is.
must have had it. There was a whole bunch of
The
us.
reason I got the shot is because I have a history of asthma. And even though it's 100% under control, thanks to the allergy shots I get, my lung capacity is still below half of what it should
half
be.
of normal.
Half of normal, yeah. Even though I work out, I do everything everybody else does, it's normal for me. But if I get COVID and it affects my lung capacity and it goes lower, I could be in trouble.
Yeah, that's what
Yeah.
happened to him. He was in trouble with all his ailments.
Yeah,
He died.
I got the shots
But you
because I.
didn't.
No, I didn't.
So maybe the shots actually helped you.
You know, they didn't help me because I
Well,
was in the
maybe they
hospital. I
did.
was
Maybe you
real
would have
sick.
died.
No.
Like your friend.
No, I had another friend that didn't hear this story. And she-
All right, we'd love to hear them all, but we got to get through these questions. So Mary Jean's going to
So-
ask you about your experience getting them. Like, was it hard, or how did you get them? What was the supply like? If you just can share.
Well, I called the county, and they came up here we both got the shots at the Shalom House. My
That's
granddad
great.
was me.
That made things easier for you,
Yeah, it
right?
did,
For
yeah.
everybody.
In our building, everybody was on their own because I remember hearing about people getting vaccinated at Shalom House. Like if I saw somebody I knew in a grocery store or something, like or people that were familiar with different people here because so many people used to visit our building to play bingo. There's a lot of friends back and forth. So I had heard that people got vaccinated in Shalom House, but our management, we were on our own.
They didn't have you
They-
come over here or talk
No,
to Walgreens
no.
or anything.
No,
It was up to the management of your building.
Yeah, we we were told we were on our own, and then at the beginning, when they first came out with the vaccines, you had to register through this website and stuff, and people couldn't get in. I mean, which was crazy, and the stores weren't necessarily taking phone calls, like,
Yeah,
you know,
right.
for people to get the vaccine.
to make
It
an
took about a
appointment.
month to straighten it out, and then it was easier to get, like, where when they opened up the convention center, then all of a sudden it was just, we ended up going there, and and everybody was going over there to Atlantic City Convention Center.
But
Yeah.
they were very well equipped.
Yeah.
Well, I had one benefit. I used to work in Atlantic City Medical Center, so I knew people of the county. So I called up, and that's why they sent them up here. 'Cause I
Oh,
knew
wow.
them, you know, so.
Oh, okay.
that's
Wow,
why-
because nobody got vaccinated in our building.
Yeah,
We
well,
were
they
on our
sent
own.
them over because I knew some of the
Right.
supervisors in the
And
county.
that's what it came down to. It was who you knew.
Right, everything comes down to,
James?
everything
Yeah.
comes down to
I
that.
can say one thing about our building, they were very good, they clean everything up, the banisters, everything, they were special clean
They
stuff.
worked very hard.
Yeah, they were very good, and they kept, people, they took all the furniture away, so it was kind of sitting next to each other, so which was good, they did it, that, you know, kept everybody safe, you know what I mean,
Right.
you know, it was good, because.
I think they did. We have very few people, I think, that were.
There was like a few were sick in here, you know,
Just a few.
yeah, a few, that didn't get out of hand, you know what I mean? So nobody, they kept up with the cleaning and all that, and they sanitize everything.
The crew here, yeah, has been phenomenal.
They were very good with
Yeah,
that.
they are good here for cleaning up.
Good.
So here's another question. Has your view changed about the COVID-19 vaccine? Has your view changed?
Yes.
From what to what? I mean, what
My
do you,
change.
like, accepting it?
Yes.
To not accepting it?
Yes.
I thought that they knew about the shots, that it's good for people, but of my experience, of what I've seen in the hospitals and people dying, I don't believe in the shots. I didn't take any more after
You
that.
die from the shot.
No, you can't die from the shot. You can die from having COVID. But they said the shots, you get them and you're safe. That's what the doctor told me. You have 3 shots, you're safe. Yeah, if you do get a little cold, nothing's going to happen to you, but it wasn't true. They didn't know, and the presidents didn't know either.
Right, so this brings up a question we were going to skip over, but I think it's interesting and part of this conversation. So who or where did you go for information about the COVID-19 vaccine that you trusted?
I can listen to the doctors and listen to the news and everything. I figured they all knew if you have to get 3 shots, 2 and 1 booster. So I figured they knew. And then I wound up getting that, and then I got COVID, and I got it really bad, and I had to be hospitalized for 6 days. My friend was hospitalized for 7 days, and they sent him home, and they knew he wasn't going to make it. Because his daughter said they told her he's not going to make it.
That's nice.
So anyway, so I didn't believe in those shots anymore because Trump believed in those shots, and then Biden took over. He said, "I'll do a better job."
We're not going to talk about it.
Okay, no politics. Okay, no politics.
Okay.
I don't.
No, I don't want to talk politics.
No, we're not
No,
going to
we're not
talk
talking.
politics. It was just about sources
I'm
of
just
information.
sources
But
of
if you don't feel comfortable, we understand. If you'd like, we can do a interview one-on-one with you, Sheila, if you'd like.
Okay.
So, yeah, we want everybody to feel comfortable, and you need to be comfortable
Well,
with what you're
if-
saying and how it impacts.
If we're not going to do politics, I'll stay.
Perfect.
Exactly.
No more politics. There are no more names of
Okay,
politicians. How about that?
no names.
So we can just say, you know, those people, those
Okay.
people.
Yeah.
Okay,
Okay.
so Sheila, who did you trust for your source of information?
Well, as a nurse,
Yeah.
you know, it was easier for me maybe to figure out where to go for sources or things. I called 211 all the time.
Interesting.
You know, that was my source. 211 connected you right to the COVID for the state.
Oh, okay. I
Everything
didn't know
was
that.
from the state. And if you dialed 211, you could get all the information
Oh, wow.
you wanted
Wow.
about where to go, what to do, how to do it. I called because I wanted to donate some time. I figured as a nurse, you know, maybe you can use me. but they said no, Atlantic City Medical Center was doing the whole thing.
I think there was a variety of places that you could go. I personally went to the internet, I went to the radio, the media. I mean, I did everything, and just word of mouth from different things. And I think putting it all together, what my family said they felt this was best for me, you know.
Right.
And everybody's got a different way that they
When
got
you
their
get
information.
older, your immune system gets weaker. And if you have other medical problems, that takes up a lot of your immune system's work.
And that enervation.
So that means how sick you may or may not
Yeah.
get.
And unfortunately, and you're a nurse, so I think you can relate to this, and we're not talking about politics, but unfortunately, this whole system, the whole disease and how to deal with it became so politicized, and it became more about politics than it did about the medical piece of it and evidence, so,
And you still have now you have distrust from a different side.
Exactly.
Which
You
is
know,
really
so
more
that's what's
weird.
a really detrimental thing that happens these days, and it's not just with COVID. Everything becomes politicized, and so it loses a lot of ability for people to sit. I mean, families can't even talk about COVID sometimes, and in this conversation. So I appreciate that actually that came up, because that's really good for the Alliance to hear how that impacts just in this room.
It's so like they don't trust the civil rights so much too.
Yeah, there's a lot of mistrust and fear and propaganda and you name it.
I have a very good primary doctor, and I rely on him. I've had him for 20 years.
That's what
That's
I asked my doctor about.
That's it.
That's why they're the ones I pay to take care of my health. So and my doctor says make your own choice, but she said it was safe.
Yeah,
That's what she
that's
said.
right.
She said it's safe, but make your own choice. And I just went online and because it's I just felt like when you got something new that comes out, just like when we were kids, we all got colds and we all got the flu over and over again, and then you reached a certain age and you didn't get it no more. And that's kind of what I think is going to happen with COVID. It's just a matter of people are going to get it over and over like they were getting colds or getting the flu, and eventually,
Syndrome.
the majority of people, there's still going to be people, unfortunately, that aren't going to make it or that get it really bad. But in the long run, I figure if I get this vaccine for a year, every year for 5 years, and everybody did it, I thought the idea of herd immunity. You know what I mean?
Yes.
That's what I look
Well,
at
it's
it
like a
as.
natural.
But I did,
Right.
but I did distrust the idea when they were telling you to get a shot after you just had one 3 months ago. That's why, I waited a year. I waited a year to get a booster. I skipped one, and I wound up getting COVID. But it still wasn't that bad.
But you
Yeah,
have to
I
follow
think
the
that-
Turn your
recommendations.
phone
Yeah.
off, please.
And
You know what, honey, your phone is on.
I think that
I can't do it. You know what that was from? Them
You can
and the
help
whole
her turn it
alert.
off.
Okay.
you could just turn it
Can
down.
you help
you
her
turn it down?
You can't. It's as
Okay,
slow
can
as
I
it-
have your telephone so I could turn it down?
Okay, you can
So,
try to do it. I'll get it.
along with what everybody's saying is that you have to become an educated consumer. You have to have places you trust, your doctors, the net, internet, whatever. But I will tell you that what has happened, and you all read this and heard about this and experienced it, is when there's underlying health conditions, people get COVID on top of being diabetic or being this or being that. It complicates things so much, and yet it's not like the vaccines were designed to keep you from getting sick. They were designed and hopefully keep you from not dying or being hospitalized.
Which is,
Think about this.
That's that
We
medical
have all
alert
the
that
vaccines
this
we
morning
need.
happened.
Anybody
I
that
knew
wants
that.
one can
Yeah.
have one. There are people all over the world that are dying, literally dying, for want of a vaccine.
That's true.
And people that, I think people that are in our country
There's a
who
certain
are
way you
just
have
so
to do it.
blasé about the vaccine, they haven't done
Okay.
maybe enough research or whatever.
Tell her to power that.
And they end up
Okay.
not
I
getting
think I
it
can.
for a lot of,
'Cause I mean, I
You
can
see
think-
people getting measles now that never got it. We never got measles when we were
I
kids
really
because we got vaccinated.
people. And it's
Is
that
that
they
the one
have
Not the only one.
an
that do it.
effect on
Okay,
other
so is the
people,
other one ring?
you know.
Huh?
Let's get it,
Right.
okay.
I can leave.
The idea of personal responsibility, you know, are you responsible for the greater good? And that's a whole medical thing with lots of vaccines, and that's a whole nother conversation, but I understand and hear what you're saying. So part of it is working with yourself and your family, and the other part is learning how to deal with other people that may have different views that it's fine, they're their views, but it could impact other people's health. So
Well, that's what
something-
happens if you won't vaccinate your child against measles. I think they shouldn't allow the kid in school.
Right, that's another.
Because I
Yeah, we can't go
Yeah,
there
that's a whole
today.
political question there.
That's not political.
Yeah.
I've
No, no,
seen
no,
a situation
medical situation.
where people have had to lose their children because they were
Yeah.
exposed to measles because some mother didn't want her kid vaccinated.
Right. And when you come from the medical field, you have that lens, and if you come from another field, you have that lens. And what COVID did is it brought to light with big bright lights that we have so many healthcare disparities in the country.
Right.
People don't have the same access to health, whether it's because of their income or their language barrier or mental health. And so these were the people
Yeah,
that were
it's-
getting sick and dying, being hospitalized.
Yeah.
So that is part of what the state's using this for as well, is to start coming up with more strategies and more resources to combat disparities in health. Another whole conversation. But back to you, Mary Jean.
All right, everybody. How do you think the state or local organizations could help more people have confidence in and access to the vaccine?
A town meeting,
A town meeting?
yeah, you know, discussing how to
Very
deal with
good.
it.
That's a
You know
great
how to deal with it.
suggestion.
Very good.
Yeah, that's, you gotta go on tour with it, you know?
Yeah,
You know what I
but
mean?
Right.
you know, there's many of the hospitals and the Life Center in Egg Harbor Township and Shore Memorial, they all have these seminars
I didn't know
on
about that.
topics.
I didn't know about that.
And you certainly can go to those and get educated, and they're out there to try and help it. and
But
give
you,
your family
you
some-
got areas though, like,
Wait, you didn't hear that, right? And who did you say,
I said,
who?
and
Jewish Family Service.
Yeah, which has, you
And we
know,
only
they-
want
I think, I
Yes.
I have two case managers from there, I said they did something else about that.
COVID?
No, I mean, about the thing, but she was talking about having people from over there.
what?
Oh, the
Well, I'm talking
seminar?
about the hospitals having these wellness
Yeah.
lectures and events, they had them, you know, all the time.
but when there's COVID, they weren't letting they weren't doing it when there was
Right.
COVID because you weren't allowed to go in.
Yeah.
Nobody, they weren't even allowing any visitors for the last 2
That was in
years.
the beginning,
Right.
but as it eased up, they had so many, they could have so many. Like JCC allowed for exercise, maybe 10 in the class, where we would normally have 30 or something like that.
See, we're lucky, like, this is basically an affluent, suburban area, you know? When you look, like, I feel for the people that live, like, in these rural areas, like, if they lived in Cumberland County or Salem County, I mean, this area is very populated, and there's a lot of educated people, and there's multiple hospitals and lots of doctors, but there's other areas of the state where you gotta wonder, like, people just went on their own, you know, like they were could have basically been on their own for this.
This is the new one.
You know,
Yes, we do it.
where they would, you know,
But
they would have a tough time.
Well, I'd be able
Atlantic
to
City
fall out. I
itself.
don't know about
There's
that.
a lot of people in Atlantic City that don't have the resources that some of the people in the Down Beach area does. And not everybody in Down Beach is as fluent as you think, you
Right.
know?
Right.
But the whole point is, everybody should have equal access to quality health care.
Not
Yep.
really that
And
easy to turn that off.
Even though that was something that has been being worked on, COVID really blew it up, which is that's a good thing that
Yeah.
there's more resources and everything. Did you want to say something, James?
I was gonna say, everybody was talking, I might want to shoot.
That's okay, if you think of it again.
Did you?
So what do you think they could do to, go ahead.
Oh, I'm sorry. I'm just saying because now, I guess I have two kids right from Jersey Service now. I know they have like things there, certain things,
Where?
Jersey Services.
Jewish Family Service?
Yeah, case managers from Jewish Family
I
Service,
got two of them.
right?
And then like
Lucky you.
like I said, I didn't know about the, there was things about COVID, about, I'm like how to explain things to you and all that.
Well, here's the thing. First of all, initially, no one knew anything. And the doctors, it was like, what's going on?
Blind leading the blind.
I meant like after
That's what it
all
was.
this, but people are still upset because they didn't have still had a handle and all that.
Okay.
You get what I mean?
Yeah. Well, we can certainly, again, after this discussion, we can talk with Mayor Mary Jean, because we definitely have now a lot of knowledge and information and resources that we'd love to share.
Right.
We can come and do it for the building, maybe just a discussion group or something. But anyway, let's move on with this particular interview.
I don't know.
We'll talk about it.
Okay, so how could they, that would be our local government, local organizations, the state, improve communications and messages about the vaccine? Yes.
I'm assuming that they have within the state government policies and procedures for healthcare issues. Like what happens if there's an epidemic or a pandemic? What do we do? See, we didn't have that. We had July of 1917 when everybody died from the flu, but they didn't have things to treat them with, so people just I think thought about that too. A lot of people I talked to mentioned that.
Right, thank you. Thanks for sharing. Okay, Frank, how can our local state governments and our local organization help to improve communications?
I honestly think that the state has done a really good job overall. Whether or not I agreed with the measures or not at the beginning, I think in the long run that the state of New Jersey has, now, for example, I get emails online all the time from the state and the health department that are explaining to you why you should get a vaccine or the effects of, what can happen if you have COVID, and for multiple other services, like for people that may need assistance to pay their rent because they can't pay their rent, they weren't working because of COVID. There's so many things that every week I'm still getting them, even after, what's it been, like over a year, 2 years since I've had this, 2021 is 2 years since I got a vaccine, when I had to register with the state for the vaccine, and then they were sending me these emails and almost like a little online brochure basically every week, and they're still doing it. So I think they've done a really good job. I mean, locally, it's hard because it's more in the hands of the doctors. I mean, you have the drugstores that are giving the vaccines, the supermarkets. I mean, you can go to Acme and get a vaccine. You can go to CVS, Walgreens, like all these different branches.
Doctor.
Yeah, I mean, so I think they've done a good job overall. I mean, just that it was rough at the beginning because you got different answers from different people because nobody was really all on the same page.
The obvious effect was that hundreds of thousands of people were dying because nothing was being done. But then, we got lucky, really, that they were able to develop a vaccine.
Yeah, because that's the quickest they ever did it.
Yeah,
But
really.
you see,
we were lucky
we're
in this
computer
area.
We're
literate.
lucky,
There are
yes.
people that are not on a computer.
That's right.
So they do not have that.
They'd have to go through
No.
newspapers or
And there
radio
were not
then.
enough phone numbers in the beginning, and I
Right.
called. They had something there, I think it was for people to get, where they can get the COVID shot in the beginning. And I called, and I said, what about the people that don't have computer? They're not computer literate.
Right. Right, because we had people in our
Where's the phone
building that they weren't, the drugstores weren't taking calls.
Because
And
I'm one of many that don't have a smartphone and refuse to get one because they're too
There's the
complicated.
other thing.
Yeah.
I have a
But you had
smartphone, but I don't know
Frank to
how
help
to use
you.
it.
That's me.
I think that they should have formed a lot of local teams. Like every area should have had a local team,
Great idea.
team event that would let people, they could go here across the street, they could go to the Bloom Center, arrangements could be made for them to go every place and educate people
But
about
wasn't
it.
that, they didn't
But everybody was scared to be around anybody,
well,
though.
nobody
Everybody was
wanted to know.
paranoid to be around anyone.
Yeah.
That was the problem.
I think it's what happened.
The fear had to
I loved
end.
it when it
The
actually.
fear had to end at some
arrows.
point.
Well,
You had to
the
go
idiocy of how it was
this
being
way
handled.
and that way. And like you're going to get COVID if you go the wrong way.
Yeah,
I took
some of the stuff was ridiculous.
I take disabled ladies shopping. They can't follow that. You know.
Yeah, that's,
Yeah,
you know.
that was.
Yeah,
that
that's
was-
right.
That was
And,
really
and right, and the
stupid.
6 feet of distance in between when you're standing in line, but they have
And
all the groceries are piled all the way up to in between
And
the
so one
aisles.
time, somebody said something to me because I was going the wrong way. I had everybody hysterical. I said, "Oh my God, I'm going to get COVID now."
Yeah. And how about your buddy, the guy you took shopping, and he started walking backwards when you told him he was
I
going
took
the wrong
him in
way.
shopping.
He started walking
walk
backwards.
So James has another perspective he wants to share because he's not one that goes on the computer and uses email.
Well, the one thing, because I can't read. So the problem is that I think they should have some kind of thing to send handicapped people, with disability, what you call it, can't read or stuff like that. And then send them then somebody can read it to them, you get what I mean? That's what I'm trying to
Heck
say.
yeah, that's a great idea.
Yeah.
Because
Yeah, they did have things
think
for
they had
visually
something.
impaired hearing.
but I didn't get none of that.
So it's hard to
No,
connect
you
the
got it.
services with the populations. So there are services and resources. Maybe not enough, I'm just saying they exist.
They- yeah.
And it's hard it is very hard to connect. We have this all the time at JFS. We have services, and we can put out all we want and do this and do that, but it's hard to always connect with the people that need the services for various reasons. And so that's always a challenge, and that's why there's a lot of health disparities. But I think that suggestion about, having more local things, which wasn't possible in the beginning, but I'm just thinking as I hear you talking, I know we go out and do JFS wellness workshops. We're talking about coming here, and we talk about boosters and linkages and everything. But we just started really doing these in person,
Right.
maybe 4 months ago? Maybe 5 months ago?
It needs to be like a year of really concentrated effort to get everybody to the same place.
The thing is that James is absolutely 100% right. I mean, we're lucky, where we live in buildings where they have social services and all like that, where there's how many other people that might not live in this kind of environment that are living on their own or maybe with family members that really don't know what things are out there, because unless you have exposure to social workers, JFS organizations, I mean, I can go back to years ago, my father got Alzheimer's and my mother didn't know what to do, and until they got a social worker involved, one of her friends happened to be able to get her involved with, she didn't know about any
They
hospice,
just don't know
they
what
didn't
to
know
do.
about anything.
Anybody-
The average person doesn't know about anything until you got the situation on top of you.
Exactly.
And James is 100% right as far as people, if they can't read or they can't do it, they gotta be able to get help another way.
There's
Yeah,
language
you
That's-
have a
barriers.
social worker?
And the problem is, before this, what I'm trying to say, when all this started, you know what I mean? You know, and then there was nobody, I didn't have nobody to help me then.
Right.
Right.
Well, who's helped you up to this point?
I just got case manager just a while ago, so I didn't know.
Relative, family?
Well, my relatives are weird, so I'm not gonna go into that.
Well, we're gonna
Another
make
thing
sure,
we're not discussing.
we'll make sure, yeah, exactly. We'll make sure that you get the services you need and follow through with that. And anybody has any suggestions, we've been to Margaret Terrace a number of times, we come to Swim House, but if there's something that's specific you'd like us to come do, speak to Rosa, speak to Liz, and, you
Well, I'm
know,
just thinking, what's your focus? What did you get a grant, a thing, or whatever to do this? What was the focus
of
for
this
you to do
particular
this?
project?
Yeah.
In general?
This
Specific
project and in
project.
general?
Okay, so this is the YMCA State Alliance, and they work with the New Jersey Department of Health. And they put on every year, it's the 10th year, creating a culture of health in New Jersey. And there's people from across the state, and they have all these resources and everything. And then from that, different projects happen and people learn about what's going on in the state, which is
Okay.
really interesting.
Yeah.
So we've worked with this alliance for a couple of years, and we participated last year. So this phase 2 is trying to see what's happening with everybody a year later,
Yeah.
when, before people could only do what they could do because no one knew what was going on and there was nothing. So now there has been some time, things have
Yeah.
opened up. So it's great to hear from all of you, like, okay, now things are somewhat going back to whatever that is. And they say normal, but I don't even know what normal is. That's this project. So we will give you the website if you don't have it already, and you can go on and you can see what all the data that they accumulated from phase 1 and what they learned from phase 1. And then they're going to take this data from across the state and do the same thing. But this year, we're especially interested in getting funding from them through Robert Wood Johnson to actually help people who took the time to share this information and have some needs, how we can support them better going forward. So that's this particular
Okay.
program. However, we have a number of wellness programs that are both about COVID and preventative screenings.
Right.
And, Rosa knows about them and Liz, but we have all kinds of things like if you aren't getting your prostate screenings, we can help you connect with that and get a $10 Walgreens gift card for that. Or, no one wants to talk about colorectal cancer, but, it's a stinky subject, but it's an important thing. And so we're trying to get more information. Bottom line is, we want people to have better health outcomes. The state wants people to have better health outcomes. We want to make sure that you're getting the same access to care as somebody who, has as much money in the world, can have private whatever. People who aren't able to read or aren't savvy on the computer, everything's gone to computerized and everything, and it's wonderful for those people that are able to use it. And for those who aren't, it's not so wonderful.
Now they're going to the phones, and that's really a mess.
Yeah, you got parking meters, you have to have a smartphone.
Yeah.
Well, that doesn't do me no good.
James, what would you like to say?
I was gonna say now, see now, I can't text, I don't have a text on the phone, I can't read it.
Right.
I showed you on my phone,
Right.
I can't read that, so.
Yeah, it's hard.
I need somebody to help me do
Get
it.
that verbally, because there are phones that will talk to you, read your text to you.
I had the flip phone.
Yeah, we're gonna work on you with that phone, but your providers,
Voice or
but your providers should call you and not text you.
I tell them that, they keep doing it.
I know. Well, we can help you with that too. All right, we're gonna have to wrap, go ahead, I'm sorry.
Yeah.
They make make a suggestion about that people that can't read, like say the computer,
Uh-huh.
and put handicapped people, what they should do is like, send like a letter to them that has somebody read it to them and explain it to them, like.
That's a really good suggestion.
Right, or voicemail on the phone, like, somebody could call you and
But you
get.
know what he's saying is great, in person is great, now that we can be in person. Is, if JFS is one of your care providers or your doctor, to be able to, know that certain people need face-to-face. Look, I can get an email from my doctor, and then I have to call them up and go, I don't really understand what this says. I mean,
Yeah, but they have FaceTime.
Oh, that's
but
another
That's
mess.
another, you have to have
Zoom
capability.
is another mess.
Yeah.
A mess.
But nothing beats this, right? Nothing beats sitting in a room,
Right.
face-to-face, talking to people.
I'll tell you something,
Right.
see, it makes it frustrating, because when you can't read and write, that's more frustrating, because when you can't read and write, it makes you more upset when you can't understand what they're saying, you get
Yeah.
what I mean?
Yeah.
Yeah.
So
Yeah.
it's hard,
No, absolutely, 100%.
you know?
Well, I'm gonna let Mary Jean wrap it up.
All right, so thank you once again for participating. We appreciate that. Is there anything else you would like to share that we did not ask?
No.
I
think you did, you covered
pretty good.
everything.
Covered everything.
Yeah.
Terrific. Once again, thank you very much
Thank
for
you
coming.
very
We really
much.
appreciate that.